The year 2020 has been a difficult year for all of us, and it has made a significant impact to our lives, especially to our healthcare workers, as they have shown remarkable resilience and professional dedication through their hard work and perseverance in combating the COVID 19 virus. Good day, everyone. We are the Group 1B from BSN 3B from the University of St. La Salle College of Nursing. I am Katrina Malaychua, and along with my members, Brian Bermejo, Patricia Borromeo, Stephanie Bulacan, Jezal Rose Chavez, and Joshua Adrian Punlu. We will discuss what our healthcare workers have gone through during these trying times. With our research entitled Gleam of Hope, Lived Experiences of Healthcare Workers During the COVID 19 Pandemic. To start off, we have Mr. Brian Bermejo with our introduction.
Introduction. In December 2019, officials in Wuhan, China, reported the first case of COVID-19, a disease caused by SARS-CoV-2, which later on spread across the globe. The development of this pandemic has been a gigantic challenge for medical health workers due to increased workload, stress, and moral dilemmas. In the Philippines, issues about the physical and mental states of health workers are starting to raise concerns. The goal of the study was to investigate and study the encounters and emotional state outcomes of frontliners stationed in Bacolod City during the COVID-19 pandemic.
So for the objectives, the study aims to investigate and study the lived experiences of the healthcare workers in Bacolod City during the COVID-19 pandemic.
For methodology, our research design is a qualitative, phenomenological research design. For the participants, we have 5 healthcare workers from different fields, preferably with a minimum 1 year of experience and have served in the height of pandemic. For our sampling technique, we have a purposive snowball sampling. For our research instrument, we have a researcher-made semi-structured interview schedule.
Theme 1, Fear, the Natural Response. Fear has been identified as one of the main concerns of the healthcare workers. The lack of personal protective equipment, unavailability of the vaccine and treatment at the time of the interview, and the exposure to a high-risk environment, as well as the possibility of contracting the virus, were identified contributing factors for the participants' fear. For the significant statements, the patients have claimed that the fear of encountering different people giving medicines and talking to patients. Sa hospital, nagating kita permi sa medicine o kung cure, pero that time, wala pa sang vaccine na hatag sa amo na, kung malatnan sa ina nga disease. Trauma gid ko ya, kay daw wala gid ko ya sense nga na-protect ko ang self ko against COVID.
Theme 2, Discrimination over Appreciation. Discrimination has been identified as one of the concerns as participants have claimed that they were discriminated by individuals that they encountered due to the belief of people in the social stigma. Such stigma entails that if you are a healthcare worker, you have acquired or is a major contributing factor for the virus transmission. Some significant statements included, ginpalayas ko sa dorm kay amo na may positive sa hospital na lang ko stay. You know, when one of them gets COVID, gina-discriminate kanila. May time kisa nga dira lang sa sagwa nimo makagwa ka man, dira lang sa gate nyo, may time man kisa nga magtulok si mo ang neighbor mo, sulod ka naman, so may ara gid mga discrimination nga experience.
Theme 3, Unpreparedness, an improvisational turn of events. One of the main issues identified centers around unpreparedness. Due to this unforeseen circumstance, appropriate preparation and response plan were not settled. This lack of preparation led to inadequate supply and use of medical resources such as personal protective equipment or PPEs and insufficient management of the hospital with regards to infection control. So the significant statements includes wala gid may nakabalo mag-handle sang hindi na pandemic kay syempre do ka first time like at this century nga may pandemic pa. Nobody was ready or nobody anticipated that a very extreme situation such as this pandemic would happen. I was taken aback. Even if I am a healthcare worker professional, even if I was genetically probably created to be a doctor of medicine, of course I did not expect this extreme scenario to happen.
Theme 4, Hope, the light at the end of the tunnel. Healthcare workers, despite their apprehension and fear of acquiring the virus, have remained hopeful and sought comfort in placing their hope to God that tomorrow may be better. They continue to live up to the profession that they have sworn upon and to be of service towards a better state of healthcare to the people. For the significant statement, as long as maka-operate ang tanan, da makayo man balang malikawan ang aton. Para man maprotect naman ang self ta, kag others sa paano mapaliw mismo sa virus itself. The next is, during the time, ang akong coping mechanism is nag-fade sa aton ni Ginoo, ug ako gimbutang sa akong pamisaron, these are all the mga ginahimo sang kaaway sa aton, mga ginahimo ni Satan. The last statement is, so kada panaog ko na sa salakyan, kapasalamat ko na sa Ginoo, ni Lord, thank you, ari ko nakapuyo sa balay. So ginaalaw ko gidyabala si Lord, do ginaalaw ko Lord, use me.
For the conclusion, the experiences of these healthcare workers vary based on their nature of occupation, institutional affiliation, and or attitude towards their work. As they have had different personal experiences, such as being infected with the virus and in return infecting their own family members, commonly they have experienced fear, discrimination, unpreparedness, and hope. As they fear for their lives with the additional discrimination due to the social stigma they have received from the people. These healthcare workers face more challenges as they encounter the unpreparedness such as the lack of PPEs and emergency response. But despite all of this, these participants still have hope within themselves and to their patients.
For the recommendations, to the hospital institutions, that they may form a contingency plan as an emergency response action in preparation to future health-related crises, and that they may also provide essential needs of the healthcare workers, such as personal protective equipment and other essential medical equipment. To the public, that they may impede the stigma against healthcare workers. Coherent information towards COVID-19 will be delivered to them, and that they may follow the implemented public health guidelines for their own well-being. To the University of St. LaSalle's College of Nursing, that they may continue to provide holistic educational institution that will produce quality LaSalle nurses. To the nursing students, that they may use the study to gain insights on what are the lived experiences of the healthcare workers. And lastly, to the future researchers, that they may conduct further studies on the lived experiences of the healthcare workers.
Thus, this concludes our presentation. Thank you and have a great day.